Hello and welcome to The Nation. Now today, discussing the topic of kidney stones and its treatment. Now we're talking about urine being formed in the kidneys that flow through tubular structures called ureters into the bladder before being expelled. So urinary stones or calculi can be found anywhere in the kidneys, ureter or bladder. Now in Malaysia, they are commonly found in the upper urinary tract or kidney and ureter. Now the prevalence of urinary stones in Asia is about 10 to 20% as compared to 15 to 18% in Western countries. So today we have the pleasure of speaking to Dr. Xeng in the studio, consultant urologist at UKM Specialist Centre or UKMSC in Malaysia. Dr. Pham joins us to talk to us about symptoms, prevention, as well as treatment of kidney stones. Hello and welcome to The Nation, Dr. Pham. How are you doing today?
Hi, fine.
Thank you for joining us. Now, before we dive into the topic of kidney stones and its treatments, perhaps you can tell us a little bit about the speciality of your field of urology. What does urology really cover, really?
Yeah, actually, urologists, we cover the organ in producing the urine, which is from the kidney, the ureter, and to the bladder. Then subsequently, we'll do is a male, we have the prostate.
Right.
Then we'll go to the urethra.
Right.
Okay, those are the whole system. And also we cover the male organ that included the testes,
okay.
the vas deferens, the seminal vesicle, which is the sperm producing organs.
Right. So everything in that whole system that's connected is under the field of urology.
Urologists, right.
So you have to study all that.
Yeah, of course. So we need to cover all the diseases from all the organ from here, which included the most common here is a stone. Then on top of that also the tumor form in all these systems included the kidney, the ureter, the bladder, prostate. So all the tumor from here also we covers, and also we're talking about male infertilities. Also we are also treating all these problems.
Okay, you did say that you are a general surgeon, so you need to be a general surgeon first before you do this.
Last time in Malaysia, our training system, to become a urologist, we need to become a general surgeon. And the urology is a field of subspeciality. Right. So after you become a general surgeon, you found your interest, then which part of the body you like to operate on, then you continue your further study on that. But recently we have a new syllabus that we no need to young doctor, they no need to become a general surgeons. They can straight to join the urology training.
So how does that work? Does that mean that they do not do surgery?
Yeah, they still do surgery, but they only operate on they're straight training on the kidney, on the bladder surgery. Like in general surgeon, when we our training, we will operate on the bowels, we operate on the breast, we operate on the thyroid. But for the new generation training, they no need to operate all these organs. They just operate in the urology organ.
I see. So they go straight into their specialty training versus the overall training first.
Right.
Okay. So now we know that urology covers all these parts. Now let's talk about kidney stones. Now, kidney stones are really, really common.
Very common.
Most of the time we hear people having kidney stones. But what are kidney stones? Perhaps you can describe to us. And why do people get kidney stones?
You know, kidney stone form when kidney excrete urine, and there is a lot of mineral in the urine.
Right.
When kidney form, urine. The stone form when the mineral in the urine in the imbalance status we call supersaturation status, which is the concentration of that particular ingredient or mineral is high in the urine. Right. Then when they are high and on top of that, when the patient is dehydrated, means that they are not taking enough water, so they will have a crystallization. Means that they start with a few small dot. Then from the small dot, they will become bigger and bigger, then become a stone. Right. So there is a lot of stone basically based on different minerals, but the most common stone actually is formed by calcium oxalate.
Calcium oxalate. Now we have a picture, we just showing where the kidney stones, but we also have a picture here of the entire system, which clearly distinguishes where the location is. So this, perhaps doctor, you can explain to us the specifics. These are the kidney stone, kidneys?
This is a kidney.
Yep.
The brown color part is our calyceal system, which the urine will form in the parenchyma, which is the meat of the kidney. Right. Then the urine will secreted to the calyceal system. Then it will flow down to the ureter, flow down to the bladder. Right. And the kidney stone will form in the calyceal system, where is the urine excreted.
Right.
Right.
So this is the most common place for kidney stones to form.
You usually form in the kidney, then usually it will fall to the ureter, and whether it can pass down or not. If cannot pass down, it will stuck in the ureter, then you will have pain, very severe pain.
Right.
If you can pass down to your ureter, to the bladder, usually it can pass out from passing urine.
Right.
So this some of the patient will say, they're passing out the stone.
Right. So, but can it also be formed anywhere else? In
It
the
can
system?
form in the bladder itself. It's called bladder stone.
Okay.
But in bladder stone, usually for those patients that didn't really pass urine well, this usually happen in those patients with prostate enlargement.
Prostate enlargement. So we have another picture here. This is just showing in terms of a healthy kidney versus a kidney with kidney stones. And you were mentioning that stones will usually form at the kidneys.
Right.
So, but you did say that beyond being formed at the kidneys, it can be formed at the bladder when your prostate are enlarged.
Enlarged and the urine didn't really excreted out, didn't pass out, fully pass out from the bladder.
Okay.
Then the urine acclimated in the bladder, then soon and later it will form a stone.
Right. So what is the difference between the kidney stones that are formed in the kidney and the ones that are in the bladder?
Basically, usually the bladder stone is big.
Right.
It is big, and the kidney stone form usually small, and it can pass out. But there is also in situation which we call Stackhorn calculi, which the whole kidney is a stone.
Right.
That usually is formed by infection. Is due to infections.
Right.
We call infective stone, and that is we call Stackhorn calculi.
Right.
Right.
And you did mention that it can pass through. So some people may have had kidney stones,
but
had a little bit of issues.
The problem is some patient must have a big kidney stone, but it's a big. So it will just keep on forming in the kidney and become the whole kidney will full of stone. Right.
Which means it will not go through the
ureter.
ureter.
No, it won't go to the ureter. It will just in the kidney and keep on bigger and bigger and bigger.
And that will become a problem.
Right, of course.
So now, in terms of in Malaysia, perhaps you can share with us how common is it for kidney stones in Malaysia? What are the prevalence in terms of the number of patients that you see?
The figure we have is around 20% of prevalence. But if let's say that is called symptomatic stone, which those patients come for treatment. I would say that if you screen the whole population, the figure will be much higher than that. I will take maybe up to 70-80%. Everybody have a silent stone in your kidney.
Right. Oh
right.
gosh.
We just didn't create any problem.
Right.
You just silently stay there. So you won't feel that.
Right.
Right.
Okay. So that is a number that you are not able to gauge at this point in time.
Right.
But we'll take a short breather right now. When we come back, we talk about some treatments available and how you are able to perhaps prevent kidney stones.
Sure.
All right. Stay tuned. We'll be right back after these messages.
Kepercayaan kepada Tuhan. Kepercayaan kepada Tuhan. Kesetiaan kepada raja dan negara. Kesetiaan kepada raja dan negara. Keluhuran perlembagaan. Keluhuran perlembagaan. Kedaulatan undang-undang. Kedaulatan undang-undang.
Kesopanan dan kesusilaan.
Kesopanan dan kesusilaan. We are Malaysia, we love you. We are Malaysia, we love you.
Hello, thanks for staying with us on The Nation. You're still with me on Bernama TV, and we're speaking to a very special guest, Dr. Pham, and we're talking about kidney stones as well as the prevention and treatment of it. So earlier, Doctor, we talked about the anatomy and where the kidney stones, ureter and bladder, and how where kidney stones are formed. But before we go into the treatments available, what actually causes kidney stones?
Again, just now I mentioned the commonest stone form in the kidney is the calcium oxalate stone.
Right.
And other than that, you still have calcium phosphate stone.
Yeah.
You have the Stackhorn calculi is usually because to screw white stone.
Yeah.
So another thing is the uric acid stone. This is usually from the patient who have gouty arthritis, gout problem.
Right.
So that's why if there's a lot of kind of minerals will contain in the stone.
Right.
Yeah.
So it must then be because of a lot of our consumption, our intake of what we
not
take
really
on,
in
or is it
Malaysia.
a genetic? How does it work?
Yeah, in genetic also there is a genetic, some genetic problem illness. It can form stone. It called cystine stone.
Right.
But we are talking about a common one, which is the calcium oxalate stone in our country, which in our country usually due to dehydration.
Dehydration.
Because we are hot,
Yeah.
we sweat, and if you're not taking enough water, so you will form stone.
Okay.
So
what is the recommended amount of water that
usually
everyone...
1.5 liter to 2 liter per day for the normal size adult. Normal
Right.
size will be 70 kg to about 80 kgs.
So if we are not consuming the amount,
You are very high
we
risk.
could potentially
Yeah.
be forming stones in our kidney.
Right. This is talking about you are not normal without any metabolic problem, any illness. If you are gouty arthritis patient, then different story. You might form a uric acid stone.
Right.
Yeah. Then if you have an infection in the kidney, then you can form this we call steroid stone.
Right. Okay. Now that we know that the most common one is from dehydration.
Right.
What are the preventive methods for us to prevent kidney stone formation besides drinking water?
Another thing you look at when we talk about calcium oxalate stone, and also we can avoid those taking too high amount of food that contain oxalate actually.
What kind of foods are those?
Basically, oxalate, the food is a chocolate.
Right. Chocolate.
Chocolate, yeah, it's peanut.
Peanuts?
Strawberry,
Okay.
potatoes,
Okay.
and and another thing is a vitamin C actually. Overdose of vitamin C, it can convert to oxalate.
So if a lot of us are taking, say for example, supplements, vitamin C supplements,
It depends on how
safe,
much you-
is it safe to do it on a daily basis?
I hardly to comment because we are talking about 1,000 milligram
Yes.
of the vitamin C. It can increase the oxalate stone. It can increase your body of oxalate to 20 to 60% of the oxalate amount in your body.
How many percent?
20 to 60%.
20 to 60%.
Right, the
So it
oxalate.
puts you at high risk as
And
well.
another thing is the food that can increase your acidic condition in your body. And that is especially like the cheese,
Cheese?
meat,
Okay, so eating more acidic will also
Yeah.
help to
Yes,
promote the environment for it. I have a question from the studio. Is there any effect for RO water, mineral water,
No.
different waters? All waters the same.
Yeah,
all waters are good.
Right, all water, as long as water.
As long as water is good.
And there is a clean water.
Clean water.
Right.
So don't have to worry if you're drinking mineral water because you see.
No.
All right.
No.
Okay,
Right.
because it says mineralizing and then
But that
crystallizing.
it's not about because the mineral water in the mineral is very minimal, and also is just in a very balanced status.
Right, okay. So don't have to worry about
Yeah,
that. So
right.
mainly about the food consumption, about
Right, the
hydrating.
hydrating.
is key.
And also increase. Another thing is we call the stone inhibitors.
What are those?
Stone inhibitor, the most common stone inhibitor is citrus we call.
What are they?
Citrus usually contain in orange, in lemon.
Right.
And you in some of the patients, even they are frequent stone former, we will ask them to take some citrate
that will
tablet.
help?
Potassium citrate tablet. That will help to prevent stone actually.
Okay,
Right.
so those
They
work.
can this kind of citrate they can prevent calcium excretion in the kidney. Actually,
So taking vitamin C itself could increase your
if you
risk,
take a low amount.
like 1,000 mg.
Right.
But if you take more citrate stuff, it helps to be able
Right,
to
that is called
prevent
stone inhibitor.
for stone inhibitors.
Yeah, this is also some ingredient is stone promoter, some ingredient is stone inhibitors.
Okay.
Right.
All right. So now we have some basic tips with regards to how to manage some prevention methodologies, especially in a hot country like
Right,
ours.
right.
Now let's talk about treatment options. I think we have heard of. We don't want to go all the way to the extreme of surgery yet.
Yeah.
So what are the basic treatment options? If you find that you are having difficulty, or how do you know you have kidney stones? What are the symptoms? What do you feel?
You will feel pain. Usually, majority of the patient with kidney stone come with pain. Usually at the long pain, back pain.
Okay.
Okay. So
Alright.
that will be at the kidney and at the upper ureter.
Right.
But let's say the stone pass all the way down to the distal ureter, they will have the groin pain.
Groin pain.
Yeah, groin
Okay.
pain. Right.
All right. And is
And on
blood
top
in
of
the
that,
urine?
yes.
Symptom?
And blood in the urine also one of the symptoms for stone, but usually blood in the usually when those patients with a stone problem, they will have blood and pain together.
Right.
But it's only blood in the urine side without any symptom. Then we need to consider others disease, especially like those tumor.
Right. So if you have pain and you have blood in your urine, it's a high possibility that it's stone.
Right.
And you should go and see a doctor and
Of
get
course.
checked.
Of course. That means that the stone is creating problem already. It's no more a silent stone.
If someone doesn't want to go to see a doctor and wants to try to do some home remedies, are there any home remedies? Just drinking more water and hopefully passing it out? Is that possible?
For me, the only home remedy is to drink more water and hopefully the stone can pass out.
Okay.
But usually the stone about 5 mm stone, the possibility of pass out is very, very high. But if the stone is more than 1 centimeter, the possibility to pass it is quite impossible.
It's impossible to come out.
Right.
Now, I think we're going to put up some pictures of stones. So we'll wait for the studio to send us some of the pictures that you have actually extracted out of people.
Right.
So this is a kidney. Tell us about this picture.
This is a kidney. I operated on it. The whole kidney has been taken out.
Yes.
Because of this stone causing blockage.
So the greenish, brownish is the stone.
And causing blockage of the kidney, and the whole kidney become non-functioning anymore and become infected.
Right.
And when open now, actually there is a pus in the kidney.
Right. So this kidney is no longer usable. It
cannot, because it's non-functioning and some more is it has been infected.
Right.
A lot by bacteria inside the kidney.
Okay, so that's what it's going to look like if you don't drink enough water, and then you have a non-functioning kidney with lots of kidney stones in your kidney. Not a good picture, not a good sign.
Yeah, it's scary.
Now let's talk about treatment options. So for example, you said that drinking some water is preventive, but those who are experiencing pain and are having blood in their urine, they should be seeing the doctor. What are the treatment options besides surgery before we go into the surgical options?
Usually I wouldn't say this is really a cutting surgery option for the kidney stone. Nowadays, all the stone surgery, we are doing endoscopy surgery.
So what is the picture that we're looking at right now?
Okay, this is inside the kidney, which I put the camera from the urethra to the bladder to the ureter all the way to the kidney and look at the kidney stone
from the
in
bottom.
the kidney from the bottom.
Okay,
right?
and that's the stone.
Yeah, that is the stone.
That is blocking the passage.
No, it didn't block this stone in the kidney is not in the ureter.
Right. Okay.
So it's just one of the calyx space in the kidney.
Okay.
So I just want to break the stone because this stone is sitting in the kidney and creating some, not really a severe pain, but some back discomfort for the patient.
Right. Okay. So when you do the endoscopy, you will be deciding whether or not you can what the treatment options are.
Yeah, there is. Usually we decide on the size of the stone and also the location of the stone.
So based on that picture, what is the treatment option for?
That is we call RIRS, which is a retrograde intrarenal surgery. This is we put the scope all the way up here and we blast the stone with a laser.
I see.
Right.
So it's blasting the laser so that it can flush out on its own.
Right.
Okay. Doctor, we'll take another short breather. When we come back, we have more questions with regards to treatment options.
Sure.
Stay tuned. We'll be right back after these messages.
Cek, ingat tak buku negara?
Mestilah ingat kepercayaan kepada Tuhan, kesetiaan kepada raja dan negara, keluhuran kelembagaan,
kedaulatan, undang-undang, kesopanan dan kesusilaan.
Sama-sama kita semarakkan kecintaan kepada rukun negara. Jadikan rukun negara sebagai panduan dalam kehidupan. Saya sayang Malaysia.
Join me, Tamina Kausji, your host and moderator for this fantastic upcoming webinar. Register at the link and full details will be sent to your inbox. See you there.
Hello, thanks for staying with us on The Nation. You're still with me, Elena Abdullah, and next to me is Dr. Xeng, the consultant urologist at UKM Specialist Centre in Malaysia, and we're talking about the topic of kidney stones, its prevention, its symptoms, its treatments. If you're experiencing one of those things that we're feeling pain in this area, you might be in for a shocker. You might have some kidney stones if you've not been drinking enough water. Doctor, we're back. We're talking about kidney stones, its treatments. You were sharing earlier before we went on a break with regards to endoscopic treatment, with regards to putting a camera in and literally blasting the stone with the laser.
Right.
And the laser is actually at the tip of the endoscopic
the camera.
Endoscopic camera.
Right.
I see. I was wondering how were you going to put the laser in after that? Okay.
Right.
So that's the endoscopic surgery. And with that, is that the most mild treatment?
Another kind of treatment we call ESWL is the extracorporeal shockwave lithotripsy.
Okay.
Means that patient just lie on the machine, and the machine will create a shockwave and blast and hit on the kidney, and from there it will go to the stone and break the stone. There will be the shockwave to break the stone.
So that is effective, or it depends on.
It is also one of the treatment, but usually for like I tell you, the endoscopic surgery and the shockwave is only for those not a big stone. Usually the recommendation is less than 2 cm stone.
Right. How do you know what's
we can measure
the size?
from the CT scan.
Okay.
Usually all the stone treatment we will have the CT scan or ultrasound. We will measure it.
Yeah.
If though really a big stone, so these two kind of treatment is not recommended. Then we need to make a hole at the kidney, and we put the camera from the kidney hole. Then we will blast the stone. That is the big stone, big kidney stone. We need to do so. We call PCNL.
So that one cannot be through endoscopic.
It's still considered a minimum invasive surgery, but it's a small hole at the kidney. Then we put the camera in.
Okay.
Then the hole will be bigger, and we are not using laser anymore. That one we use the lithocrust. We use blasting the stone with some other machine, which can more efficient in breaking a big stone.
So essentially, if the stones are small, like you said, 2 mm and below, you can do endoscopic or
the
shockwave lithotripsy.
Right. And also we need to see the location.
Right.
If let's say this is the stone form at the lower pole here.
Yep.
So and you use a shop out to break the stone at the lower pole, but you see it's anti-gravity.
Yes.
So the stone also still cannot come out.
Can't suck it out.
Can't, because it's outside. You just blast, then break the stone.
How do we encourage the broken ones to come out?
Usually by drinking water.
Okay, still have to.
So usually for those who are lower pole stone with we call acute angle, see?
Yeah.
We are not that kind of stone not recommended for shockwave.
Okay, what would be the recommended treatment for that?
There will be the endoscopy surgery. We will just go in and blast it, and the big fragment we will just take it out.
Okay.
Right.
So those are the two, and then if those stones are larger, you will make an incision and a hole on top in order to use a different
more invasive, more powerful machine to break the stone.
Okay.
Right.
And then there is, of course, even more severe cases. What will be the options?
The severe cases will the one I have shown in the picture just now, which the stone already make the kidney normal functions. We call non-functioning kidney, and it created problem because it's infected. The last one we usually take out the kidney. They will do a laparoscopic nephrectomy.
Right. So, but that means that you still have one functioning kidney that you still be able to use.
So the patient need to really take good care.
Okay. Now, you were mentioning there are quite a few types of stones. And the ones that were at the kidneys, they were the few types. What was it? Calcium
oxalate, calcium phosphate, uric acid stone. These are a few common ones.
So those were
we will never know. We will never know.
Okay.
Usually we will see what kind of if your patient, the patient had gouty arthritis, then most likely patient have the uric acid stone. But other than that, we will never know the content of stone. And on top of that, usually is a mixture of stone. We will see what is the majority content of the mineral of the stone, but usually we didn't do that, because if you want to do that, we need to take out the stone and we need to send to the lab, and the lab will so-called do stone analysis, which usually we didn't do this.
Now let's talk about treatments available here in Malaysia. So at UKMSC, you can of course get the treatments. All the treatments that we mentioned are available at UKMSC?
Right.
Okay, and what are the treatments available? And okay, so which means how long? I just want to have a gauge. How long does it take for an endoscopy versus a shockwave lithotripsy?
So in the endoscopy surgery, at least you need a spine. You need some anesthesia,
Right.
to make yourself not feeling the pain.
Yep.
It's either by the GA or spinals.
Okay.
And the shockwave usually is awake.
Yep.
Then you just lie there and just blast for about 20 to 30 minutes like that.
Okay,
Yeah.
so shockwave sounds quite fast,
Yeah,
20
very
30
fast,
minutes.
yeah.
Endoscopic, how long will it take?
It depends on the stone.
Okay.
Usually, if a standard 1 cm, so it's not really hard. The surgery will take about 30 minutes.
Okay.
Right.
And how expensive can these treatments cost? Ranging from?
Is in government setting, our government hospital, usually the hospital fee is very, very cheap.
Yeah.
But if you talk about in private, it started from 10K.
10K onwards.
Right.
So not worth it. Drink
Not
more
worth
water,
it, yeah.
people.
Because it involves a lot of high technology instrument.
Right.
Laser, camera,
Yeah. Yeah. And these are done with. Do we have enough equipment and expertise here in Malaysia?
It's very, very. In most of the hospital, the equipment is ready.
It's all in
Right.
place.
Yeah.
Thank you so much, Doctor, for sharing with us. I am very now aware of making sure that I drink more water in order for us to not prevent kidney stone. I think a lot of people don't realize whether or not we have it.
Yeah.
So I think prevention is always better than cure.
Yeah, of course.
In order for
Right.
us to not encourage any further complications.
Right.
Any kind of invasive surgery would still have some kind of risk involved, correct?
Risk. Any surgery have risk.
Right.
Right.
Thank you so much, Dr. Pham, for sharing that with us.
Welcome. my
Any
pleasure.
last messages to viewers out there?
Again, prevention better than cure. Drink more waters, and if you have symptoms, please see a doctor.
Please see a doctor. Thank you so much, Dr. Pham.
No problem.
We were speaking to Dr. Pham Xeng In, consultant neurologist at UKM Specialist Centre UKMC, UKMSC in Malaysia, about symptoms, prevention and treatment of kidney stones. Now, effective kidney stone prevention depends upon addressing the cause of the stone formation. So staying aware of our consumption habits and being well informed will help towards better long-term health. Thank you for staying with us till the end of the nation. I'm Milena Blah. Bye for now.
Bantut mengakibatkan kesan yang serius kepada kanak-kanak dan menjejaskan prestasi pembelajaran mereka.